watching News Epicenter here on CNN News 18. I'm Ridhima Bhatnagar. After implementing an extreme zero COVID policy over the last few years, which saw people being held up in their homes, close contacts being isolated, and people having to even jump off their houses to escape isolation, the situation has now gone from bad to worse in China. According to a top epidemiologist and health economist, Feigl-Ding, hospitals are completely overwhelmed in China. The epidemiologist has estimated that more than 60% of China and 10% of the Earth's population are likely to be infected over the next 90 days, and millions of deaths are also likely to occur. As per reports, one of Beijing's designated crematorium for COVID-19 patients has been flooded with dead bodies in the recent days. The epidemiologist also revealed that funerals are taking place in Beijing 24/7 and over 2,000 bodies are backlogged for cremations. With the rapid rise in cases, schools in Shanghai and many other cities have been closed for the next month. The virus is also hammering China's economy, expected to grow 3% this year, its worst performance in nearly half a century. The World Bank has also slashed China's growth forecast to 2.7% from 4.3% for this fiscal, citing lockdowns across cities and weaknesses in the real estate sector. It's also revised the forecast for the next year. At the cost of not wanting to sound alarmist, but it's not just China that is worried today. If we had one learning from 2020, it was what happens in China doesn't stay in China alone. How worried should we be then? So as we said, things are going from bad to worse. How bad is the situation? What are the numbers that we're looking at? And how big a failure has been the zero COVID policy? Let's break down all those details for you to help you understand what really is happening in China today. As far as the zero COVID policy is concerned, what did it actually do? Every known case, even asymptomatic, was mandatorily hospitalized. But what it eventually led to was the vast majority of population that hadn't been infected has no immunity at all. More importantly, what did the zero COVID policy on the ground do? Even small outbreaks triggered hard lockdowns. This was seen as an extreme decision even back then. And what did it eventually lead to? Fast-spreading variants like Omicron are managing to break through. What else did the zero COVID policy do? The suspected cases and even their contacts were kept under long isolation, and that's why I said you had those heart-wrenching visuals that we'd seen from China of people even jumping from their houses just to escape isolation. What did it eventually lead to? The virus was able to spread rapidly after encountering pool of susceptible people as well. What else did the zero COVID policy do? And we also want to talk to you as far as what we're understanding in terms of the numbers that are coming out of China. That always has been a gray zone. But what about the death figures, and how is China categorizing quote-unquote COVID deaths? What we are now understanding is no COVID-related deaths reported from December 4th to 18th. But as we pointed out, some of the videos that have been put out by epidemiologists like Feigl-Ding and others show a very different picture. Despite busy crematoriums, only 7 deaths have been recorded in Beijing. And as per the report that has been put out by various epidemiologists, many crematoriums in Beijing are actually seeing cremations 24/7. Deaths only from respiratory failure are counted, and this is where many experts are now raising a red flag. Deaths due to comorbidities are not counted as COVID deaths to try and bring down the number. Is this policy really going to help? That's the larger question. COVID patients who died due to heart attack also not being counted as far as COVID deaths are concerned. And that is why we said it's not just China that is worried today, but that pressure is being seen globally as well. Without wasting any more time, I want to bring in our newsmaker for this evening, the epidemiologist who is predicting the worst as far as China is concerned. Eric Feigl-Ding is now joining us on the broadcast. Eric, we appreciate you taking out the time and joining us here on CNN News 18. We've all seen the tweet that you put out, a very gloomy picture indeed. How bad is the situation in China, just in terms of numbers? How many have been infected and how many more do you see being infected in the days to come?
Yeah, thanks for having me. I think the problem is that China is facing a very, very horrible burn-through crisis. And by burn-through, I mean by mass infection because of lack of containment of the virus. And if you think about it, 60% of China being infected is not that out of the realm of possibility, given that in most Western European and US and India, most people have been infected. And we saw the horrible outcome of that, starting in spring of 2020. And in India, as you remember, in the Delta variant wave of April, May, June of 2021, that's easily millions of people can die when you have a burn-through situation. And the problem is, unlike other countries, China still has mostly virgin fields of uninfected people, and pretty poor vaccination rates and booster rates. So I think China is very, very vulnerable. And that's why all the models show that if you don't contain it, if China doesn't reverse course, they will easily have over 1 million deaths and likely 2 million or more.
That number, of course, is not looking good, Eric. And I'll talk to you about the policy in just a bit. But just as far as the severity, I want to understand which variant are we looking at and how bad is the severity?
Yeah, the variants, there's many, of course. The main one in China, for example, that people talk about is BF7. And BF7 is one of the subvariants of BA5, which is a subvariant of Omicron. And it's a very evasive one. It's one of the most highly evasive ones, second to XBB or BQ1. It's like an alphabet soup of variants right now. And the alphabet soup of variants means that all of these highly evasive, they do not care about previous infection. They can easily cause reinfection. And for those who are not boosted, so those who just have 2 shots, it does not offer that much protection unless you have boosting, and preferably bivalent boosting. But China doesn't have bivalent boosters of BA5. Like, for example, US offers BA5 adapted vaccines, while China mostly, it's CoronaVac and Sinopharm, is still using the main old Wuhan 1.0 spike protein vaccine. Now, China does have a new technology called the aerosolized inhaled mucosal vaccine, which you inhale it, but that is still very limited in use. And the main issue is that the elderly are just not getting vaccinated enough. So I think the variants are inherently leapfrog over many of the older vaccines. And those old generation vaccines are just not enough, especially if you only have 2 shots.
And the vaccination rate is very low, as you pointed out, and we'll get to that also in just a bit. But I remember speaking to you when we were talking about the first and the second wave, and at that time you had said the doubling time is very important to note. This time around, what about the doubling time? How fast is it spreading?
It's hard to say because China does not have good reporting anymore. They've stopped their mortality reporting for the most part. But if you just look around hospitals are their fever clinics are pretty full. Just yesterday, I had to cancel an interview with a group in China because half their media team is actually sick. So, if that's happening, that there's a lot of exponential growth, but there's no real good data, especially a doubling time, it depends on testing, right?
True.
But if there's much less testing than before, just trying to stop the complete random testing system, then you're not going to have a good sense of that. But we know it's very, very fast. So we know huge numbers of people infected, and tons more will get further infected.
Eric, that's why I started the show by putting out some figures. As per official records, only 7 deaths have been reported. But we've seen the videos that you've put out. How are hospitals even managing? What about crematoriums? One of your tweets said that Beijing is seeing cremations 24/7.
Hospitals, they have fever clinics, and right now the public is being told. The ironic thing is the public was previously told COVID is very serious, which it
Yeah.
is, and now they're saying, "Oh, don't worry if you have mild COVID, keep coming to work." So a lot of doctors and nurses are actually going to work sick, and there's just not enough. People are being told to stay home, and in many ways, China has actually fewer per capita beds, doctors and nurses than many other countries.
True.
And so they know that with a crisis like that, you're not going to be able to, you can build more hospital beds, but you're not going to suddenly build more, doctors and train more nurses.
Yeah.
So I think inherently China is in trouble because, Hong Kong, just look at Hong Kong as the best example. Hong Kong reopened in the spring. They had very, very high hospitalization and mortality rates, and China learned a lesson. But and Hong Kong at least actually has higher vaccination rates, and Western mRNA vaccines that have higher efficacy. Mainland China does not, and so this is why the outcomes are likely even worse. And if you just take the rates you see of deaths in Hong Kong and put it in mainland China, you easily get over 1 million, 2 million deaths.
So one at this point would ask, Eric, then where are China's medical supplies going, or where is the vaccination going? Is it vaccine hesitancy or is it something else?
Well, China does have a lot of medical supplies, but I think the other issue is like, like India, China is like a factory floor for the world in producing a lot of medicines, and there's shortages of ibuprofen, for example, and many other medicines because of this inherent surge in fevers. Now, it's going to a lot of the people who are sick. Now, eventually, will there be enough exports? Will China be exporting worldwide a lot if its factory shuts down? I'm not sure. But the issue is that China does have a huge, huge problem with infections right now. You cannot deny it. With people lining up for medications, people out sick, schools with a lot of kids sick, and hence in Shanghai they had to close. It is just, it's undeniable. There's a huge number of cases. And whether or not you admit the deaths or not, it doesn't matter, because clearly the morgues are filling up and the crematoriums are filling up. And that's what really worries me, that if China does not admit and come out and with the truth how badly the situation is going, it's only going to get worse.
So, Eric, that I want to understand, and this is something that you touched upon earlier as well, that there is an issue as far as people who are going forward and take the vaccine. So I want to understand, is it this time around the severity, is it because the issue of efficacy of vaccines, or is it simply because of the severity of the strain that we see?
No, it's a combination. First of all, China is under-vaccinated. Like, people have 2 shots, but you don't have a booster shot. And the booster shots they use are using the old booster shots, not the new BA.5 new generation booster shots that we use in the United States. And furthermore, I think the other issue is just China is the only country left in the world that has huge virgin population of uninfected people. And so they're incredibly vulnerable as well on top of their older vaccines and low efficacy. Because China's CoronaVac is traditionally the least efficacious of all the vaccines we use worldwide. So it's a triple storm. And of course, now they're relaxing measures. Although it's not like 100% relaxing like in the West.
Yeah.
But I would say it's like more like halfway between old Chinese policy and Western Swedish models, which is also very crazy. I think the relaxation on top is only further accelerated.
So you're saying the relaxation is only accelerated as far as this, COVID surge is concerned. So I want to understand, you go from extreme lockdowns to no restrictions at all. This position, do you think that is becoming problematic?
Well, the extreme closures, of course, have led to people being frustrated. And some people say it hurt the economy, but I argue, if the economy in terms of the population is decimated by hospitalization and death, and also long COVID, which affects 20-30% of all infected people, what is the long-term economic consequence?
Yeah.
I think in many ways, China should have taken a moderate route sooner, but China is not relying on other measures such as you almost never see N95 masks in China. Meanwhile, in South Korea, everyone uses N95 or a KF94, which is the N95 equivalent, and Japan as well. But China, you don't see that.
Yeah.
Also, ventilation, air disinfection. Japan really knows that the virus is airborne.
True.
It has very strict ventilation, air disinfection standards. China does not. And so all these things in which there's many other things besides, testing, lockdowns, and vaccines. There's, N95 masks in public spaces and also ventilation, air disinfection, which China is not doing. Yeah. I think if China recognized those things like Japan did and wore masks like Korea did,
true,
then I think China could do much better, because those South Korea and Japan are not did not have mass burn-throughs like India or Europe did. And at the same time, they are still relatively zero COVID, no COVID because of all the other measures they're doing.
There's a sense of very unfortunate deja vu, Eric. What I essentially want to understand, what about the global fallout? If we had one learning from 2020, it was that whatever happens in China, unfortunately, doesn't stay in China. How worried should we be globally today?
I think I'm worried in terms of if you infect 800 million people in China, how many new variants will that spawn? That worries me a lot. Also, China is the factory floor of the world, and if China has an economic meltdown because of a lot of these shortages, if factories are unable to produce, then what does that mean for the worldwide shortages of not just medicine but also many other consumer goods? All these things, we know the supply chain was partly caused by the pandemic, causing a huge number of economic disruption, and if you disrupt the economy of China, not just one city like Wuhan, but if you have outbreaks in dozens and dozens of mega cities with 10 million people or more, 5 million people or more, what is the economic fallout? And I think that could be really, really bad for the world.
Eric, always a pleasure speaking to you. Thank you so much for taking our time and joining us here on CNN News 18. Well, you heard it from the epidemiologist himself. I also now want to open it to our panel to try and understand what can be done, and are we really underestimating the severity of the situation. We have Dr. Benjamin Cowling, Chair Professor, Epidemiology, School of Public Health, University of Hong Kong. I also have Dr. Sarah Pitt, Principal Lecturer, Microbiology, University of Britain. We also have Jennifer Zheng, Chinese whistleblower and human rights activist. Good to have all of you on the broadcast with us. Jennifer, I'd like to begin the conversation with you. You, like Eric Feigl-Ding, have shared a lot of videos, and I've seen the kind of tweets that you've put out in stark contrast to the official numbers that are being reported from China. Let's begin by understanding how severe is the picture on the ground.
We can only say very, very severe. I already put the number there. In usual years, every day there were about only 300 bodies got burned, cremated per day. Now, all the crematoriums are operating 24 hours per day, and they have a capacity to handle 4,000 bodies, but still you have to wait. In the initial days, we heard you have to wait for 7 days. And today, I heard another WeChat conversation where a man actually just went to one of the crematoriums in Beijing, and he was told now the waiting time is 30 days, 30 days.
Wow.
And the price is 30,000 yuan to have one body burned in Beijing. So you imagine the sharp jump and how bad the situation is. That is only from one estimation. And also there's a report from Minbao. It's a Chinese newspaper in Hong Kong.
Okay.
They did their own investigation from their own resource that on December 17th, one day, there were 2,700 people died of COVID at home alone. So only for the people who died at home is 2,700, and that number not include those who died in the hospitals.
These 2,700 deaths that you're talking about of people who died at home alone, what is the time period that we're looking at, Jennifer?
It's one day in December 17th, 2,070 people died at their home on December 17th, one day in Beijing, 2,700.
Okay, Ben, I want to bring you also in the conversation. What Jennifer essentially is saying that crematoriums today have a waiting period of 30 days. That's how dire the situation is. You're in China. Help us understand what you're seeing around you.
Very concerning. We know that already in Beijing, the emergency rooms are under severe strain. There's too many patients needing attention and not enough staff, not enough resources. And also we've heard, unfortunately, that in Beijing, the funeral homes are much busier than they would normally be at this time of year. And that's also an indirect indication that there's already likely an increase in COVID deaths across the country. Now, of course, because in China, they've almost stopped PCR testing, it's difficult to know exactly how many infections are occurring. The confirmed case numbers are not very meaningful anymore, but we have to think about other indirect sources of information. For example, the funeral homes being very busy, which is a worrying sign.
So even as epidemiologists are, doing surveys in funeral homes and crematoriums to understand how dire the situation is, Sarah, I want to come to you and understand how should we see the strain and the severity? If you go back to 2020 and this, waves that we saw, the first instinct at that point was to impose lockdowns. But of course, we've learned there is vaccines now, a lot more technology to deal with the pandemic as well. This time around, how different is the strain that we are seeing and what is the way to tackle it?
So the original strain, what we found was that on average, somebody with COVID would infect between 2 and 3 people, which is still quite a lot. And that shows how it spread so rapidly. And now with each variant, it's become that bit more infectious. And the estimates are that it might be that one person with COVID can infect 9 others, which is really a lot, and a lot more than we were expecting. That we've seen previously. Obviously, if you have some protection from the vaccine and perhaps from previous infection, that does bring that number down a little bit. But as we've seen that in China, they're saying that not insufficient people have had the full course of the vaccine. They're saying that they're reporting that the over 80s, which of course the most vulnerable population, only 40% of those are fully vaccinated. So the 1 in 9 figure is probably quite likely. Of course, the other thing is if the virus is allowed to spread widely through a very sort of immunologically vulnerable population, we might see the emergence of new variants. Although what we've seen across the world is that, but all we're seeing at the moment is slight changes to Omicron. So the virus has stopped at Omicron and is just slightly changing, but different versions of Omicron. But of course, we've seen that before. I always thought Delta was going to be the definitive version of the virus. It was sort of stopped there. And then now we've got Omicron. So there's no particular reason why we might not get a whole new variant, but equally we might not. We just don't really know. And that's one of the things which we've seen in the last 2 years, that this virus is really very unpredictable. So we have to be prepared for the worst, because we don't really know exactly what's going to happen. But based on what we've seen before, we can know that it's super, super infectious and it's so easily to spread it. And even if you don't have symptoms, lots of people, maybe 1 in 3 people have COVID, don't have any symptoms, but are infectious to other people.
But the kind of numbers that Jennifer is quoting to us, which means the severity is a lot. If you're seeing upwards of 2,000 deaths in just a single day. So Jennifer, when you say that, cremations are taking place 24/7 and there is a wait time of almost 30 days, I want to understand how are hospitals even dealing with the kind of severity that they're seeing on the ground?
It is very, very bad. I see, we see videos of overcrowded hospitals, and now we see videos of people having to stay with the bodies together in one of the rooms. And I saw a video of two girls sharing their own experience, how they struggled so hard to try to get their family to be admitted into the hospital, but there was just no way. One girl said they went to 3 hospitals in one day. The first hospital, they waiting hours, at least 4 hours, and her father couldn't wait.
Oh, God.
They went to the second one, they only get an infusion. There was no bed, and during the time when her father was receiving the infusion, 6 people died there, and she had to went a third hospital, and the doctor said there's no hope because we have only 10 plus people died today. Only some people died. There can be more beds available, so you'd better go to another hospital. They have more people died today. Maybe they have beds available.
So people are actually being turned away because hospitals just don't have that infrastructure. So as Jennifer is telling us about a family who actually had to run pillar to post from hospital to hospital just to be rejected. As I said, a sense of deja vu coming back to all of us. But Ben, I want to bring you back in the conversation, and I want to talk to you about the low vaccine rate in China. I'm actually looking at some numbers. If you look at the 18 plus, only 66.4% have taken the 2 doses, and it's just a little above 40% for people who've taken a 3rd dose. Why has that happened? And doesn't that become a real worry then?
Yeah, that's right. It's a big surprise because just 1 or 2 months ago, the government in China was saying how important it is to keep COVID under control, to keep cases at a minimum because of the threat it poses. And then just 2 weeks ago, the government did a very abrupt U-turn and now relaxed all their measures. And we know there'll be a very large number of infections within the next maybe 1 to 2 months. I'm surprised that there hasn't been more effort at slowing that process down. That's called mitigation. Most countries have done that at some point in the last 3 years when facing a large epidemic. You try to slow things down, flatten the curve, ultimately to save some lives, mainly because when hospitals come under pressure with a lot of patients needing medical attention at the same time, that's when it's really not ideal. And that's when there can be an increase in the mortality rate just because of a lack of resources and the pressure that occurs at that time. We know that's happening right now in some parts of China.
Jennifer, just taking on the same aspect of vaccination to you as well, have authorities on the ground completely given up? What happened to the sense of urgency, wanting people to vaccinate? Why are we seeing such a lag in the numbers of vaccination being reported?
I think another reason is the quality or effectiveness of the Chinese vaccines.
Yeah.
So far, Chinese people are basically only receiving Chinese-made vaccines, and the effectiveness, as we know from other countries, was not that bad. And what worried me right now is I think the basic attitude of the Chinese Communist Party is not let's get the people vaccinated as fast as possible. Actually, before they decided to ease up the lockdown, they even did not notify the hospitals and the pharmaceutical factories to get ready because we could have, waves of new outbreaks. So you'd better get ready. The hospitals were totally unnotified, as well as the factories. Actually, I saw a notification 2 months ago, like they are forbidden pharmaceutical shops to sell fever medicines to public, because if you buy fever medication, they can't catch you. At that time, they want to catch everybody who might have a fever, so they can take you away as to the quarantine center. So I think the current real policy of the CCP is get as many people infected as quickly as possible, so this thing can be over. And they have announced deadline. They want this to be over by March next year, because that was when the CCP will have its annual
Jennifer, these
so-called
deadlines
2会
we've seen haven't worked in the past. The zero COVID policy was criticized by experts and epidemiologists right from the start, questioning that this extreme lockdown, one, will not be beneficial as far as people who you're locking up inside, but also as far as herd immunity is concerned. So now what we're seeing is from that extreme lockdown to opening up everything. What is the plan, if any, at all at this point with the Chinese authorities?
Sorry, what is the point?
No, I'm essentially trying
I think when they were adopting the COVID zero policy, because that is a political, political symbolic for the CCP to declare they have systematic advantage over Western countries, over democracies, because they have the ability to lock everybody up. So they think that is a political achievement of their system. That's why they can't give it up. And now why they suddenly gave it up? Because they found it already failed totally. Now, since they've already gave it up, they are now, according to my, I think, imagination, they are now want to trade lives for time. They want this thing to get over as quite quickly as possible. They don't mind how many people died. Yeah. They just want everything to be over by next March, when Xi Jinping will formally in his office for the third term, when his so-called election can be endorsed by the People's Congress in March. So they want everything to be over by then. So to get everybody infected as quickly as possible. And the officials in Wuxi City in Jiangsu province even got criticized because the infection didn't spread fast enough in that city.
Wow, that's so unfortunate to even hear. And I'm actually pinching myself that I'm actually hearing this as a narrative of what the authorities on the ground are working with. But Ben, I want to quickly come back to you, as I was asking that this extreme position, how worried should we be globally about this extreme position? Because as I said, what happens in China is not going to be restricted to China. So will we see a vicious cycle of lockdowns and restrictions once again as well?
Well, it is. We should say that overall, in the country as a whole, according to the National Health Commission, that's the Ministry of Health in China, 92% of people have had at least 2 doses. That's a very high vaccination rate. I don't think there's many places in the world that have such a high vaccination rate. But as you mentioned, in the over 80s, in their very old adults, unfortunately, the vaccination rate is not as high, particularly with 3 doses. And the World Health Organization says that for inactivated vaccines, older people should get at least 3 doses, because the protection from inactivated vaccines can be a little bit lower in older people. So it is a concern. And I'm worried right now, because for most people in China who get COVID in the next 1 to 2 months, it will be a very mild illness, maybe fever for a few days, maybe some other symptoms, and they'll recover with a full recovery. But for older people, particularly if they haven't been vaccinated, it can be a serious infection. We have the misperception that Omicron is milder than the previous strains. It's not quite true. Intrinsically, just in terms of the virus, actually the severity is very similar. The difference for most people around the world, most countries around the world, with high vaccination rates, with lots of immunity from previous waves, Omicron is milder. But if you have it in an unvaccinated population of older people, that's when it can really still cause problems.
I think that's a very crucial distinction that you're making, that compared to Delta, yes, Omicron is milder, but if you catch it when you're unvaccinated, then the severity will be much higher. Before I come back to you, Ben, to try and understand what would you want to suggest to the authorities at this point, considering the fact you are in China. Jennifer, last word from you, where I want to understand, because you've been seeing reports and you've access to a lot of videos, what is the estimate that you're working with? Say in the next 1 month, how many cases or how many people can we be seen in being infected?
I think many people in Beijing are reporting that 60 to 70% of the people they know have already been infected. So if you put 60 to 70% to the whole population in China, that's about over 800 million people. And so I think that's maybe a very reasonable estimation for now.
Okay. Ben, final word to you, considering the fact you are in China and you're seeing the surge. What would your advice or message to the authorities be? Should you see, shutdown of maybe schools, educational institutions? What would you suggest?
No, I don't think there's a rationale to go back to all of the zero COVID measures, which included complete lockdowns, repeated PCR testing of everyone in a major city every day, PCR testing everybody every day, and then isolating very strictly and so on. I don't think there's a need to go back to that. I think the policy has changed. Now the plan is to move back towards normality. But COVID is still spreading very fast in China, and there's an opportunity for the next maybe 2 weeks, maybe the next month, to slow it down, to spread out the infections over a longer period of time, and to reduce the peak when the peak does occur. If it could be a smaller peak, that would be better. And I hope that measures will be taken. For example, for the next 2 weeks or the next 1 month, have a mask requirement, maybe have more social distancing policies, just for a short period of time to slow this exit wave down, because it's moving very, very fast.
Because unfortunately, as we've said from day one, it's not over till it's over. I'll leave the conversation there, Benjamin, Jennifer, as well as Dr. Sarah Pitt. Always a pleasure speaking to all of you. Time for us to slip into a very short break. Don't go anywhere. We're coming back with lots more.